Welcome back. For those of you who don't know, I'm Ivorie and I am a licensed clinical psychologist. Before I move any further, let me just say, Happy Men's Health Month. This month is meant to bring awareness to health conditions that affect men and to promote healthy behavior so that we can prevent those health problems and be able to effectively treat them if they do arise. Men have shorter life expectancies than women, are less likely to have health insurance, less likely to go to their annual doctor's visits, and are more likely to die from heart disease. And some of the risk factors for heart disease are high blood pressure, high cholesterol, diabetes, obesity, smoking, and you guessed it, depression and emotional stress. 6 million men are affected by depression each year, and men are 4 times more likely to commit suicide than women. So as a psychologist, I want to take this opportunity within Men's Health Month to talk about mental health and men. I'm sure you've likely heard that the mind and the body are connected. Whoever told you that was right. Our physical health, mental health, and cognitive health all affect each other. So depression is a risk factor for stroke, and you're also more likely to be depressed after you have a stroke. Ever wonder why you feel like you're on an emotional high after you work out? That's because at the very basic level, exercise releases chemicals called endorphins and serotonin, which help to improve mood. Exercise also helps to improve your sleep, which who doesn't feel like less of a grouch after a good night's sleep? The majority of men actually report that their main reason for exercising is to reduce stress. So, way to kill 2 birds with 1 stone, fellas. Men are also more likely to hide their stress and are less likely to take a mental health day from work. This may lead to a buildup of stress over time that you're not even aware of. So your body is in this constant state of fight or flight activation. And so your shoulders may be up to your ears and you might have this tension built up in your neck and your back. You might even start to have headaches, dizziness, trouble concentrating. Your sleep is trash. You're starting to have stomach issues and you don't really know why. And ultimately, you're at a greater risk of getting sick and developing chronic health conditions. To add insult to injury, men are more likely to downplay physical and emotional pain, which can lead to longer recovery times and a delay in getting the treatment that you actually need. This is a topic for a whole other day, but people with emotional stress tend to have longer recovery times from concussions. In order to have a well-rounded discussion about mental health in men, I asked a couple of people to tell me what images, words, and thoughts came to mind when thinking about men. Unfortunately, people in my town are a little bit camera shy, so I'll just insert their answers here. I also invited an old friend, Dr. Will McBride, to add a little spice with his expertise. Dr. McBride and I both completed our doctorates in clinical psychology. He has done a lot of work in the VA, which is heavily male populated. He has also done multiple talks about guidelines for working with men and young boys, and he has served in a role of recruitment for Black male college students, focusing on recruitment issues specific to men. So, future Ivorie and Will, take it away. So before we dive in, I want to do kind of an icebreaker with you. So we'll play a game. Do you remember that game, Concentration?
I have
Concentration, ideation, or whatever the words are.
Okay, let's say I did.
Okay,
yes, sure.
So basically the concept of the game is that we have to go back and forth saying different words or phrases within a certain category. We're going to go back and forth saying terms or phrases that come to our mind when we think about things that men hear growing up or even as adults that kind of get integrated into our self-talk. Okay?
Okay.
Play through it.
Tough.
Okay. Boys don't cry.
Pick yourself up.
Suck it up.
Men don't cry.
Boys don't wear pink.
That's a good one. Tough it out.
Boys are meant to be big and strong.
No pain, no gain.
Men don't talk about emotions. I think we thought of a lot, and I'm sure that there are many more out there that maybe you in the audience can think of. So if you do think of anything that you've heard as a man growing up or women that you've heard said to men coming up, then put them in the comments below. So the reason I wanted to do that little exercise with you is because we know that as we're growing up, things that we're told can become integrated into the things that we say to ourselves.
So you're absolutely right, Ivorie. I want to take a step further back to talk about kind of some of the details that APA lines out when working with boys and men. You know, the big buzzword is toxic masculinity that we hear in the news and media, but what we really should be thinking about is what we call like traditional masculinities. What are the traditional masculine ideologies that people are growing up with? And they can differ based on race, ethnicity, religion. Typically, we see that the ideology, the traditional kind of what the societal things are for the U.S., not talking about emotions, like you said, you know, sucking it up, you know, high academic achievement, high achievement, this sense of, you know, perpetuating power and dominance and things like that, and, you know, not having interpersonal dialogue or intimacy in relationships. So those are some things that we think about when we think about the traditional masculinities.
Why would I think about you?
Because we're friends. We're not animals.
We're men, Schmidt.
I asked Will if he sees any differences in the types of stressors that plague Black men specifically. Let's see what he said.
I think the general mental health and physical health issues that you see in men in general are much more exacerbated in African American men. In terms of economic resources, being able to go to therapy, you know, Black men are at a disadvantage in that way. I think also a lot of the stereotypes or, you know, kind of thinking about why we shouldn't go to therapy are magnified more in Black men. It's definitely this, what you call a hypermasculinity is magnified in a lot of Black men. I think there's a number of driving forces. I think it's part of the survival, and it's been adaptive. In the acute sense, it's an adaptive behavior to help you guard yourself from traumas and different things. You know, growing up in poverty or growing up in an environment where you know, you don't have enough to eat, or you don't have there's high rates of crime or different things where you have to compartmentalize those emotions to survive. In the long term, it becomes detrimental to their well-being. Behavioral issues that are going to be highlighted in our minority kids at a greater rate than their white counterparts. They're going to be diagnosed with ADHD and these other externalizing things, when really there's a lot of internal stuff that's going on that needs to be addressed.
Given that our country has recently seen the building effect of ongoing racism and police brutality and the effect that that is having on the Black community, I asked Will to share with us some of his insights about what is important to work on with Black men in therapy at this time. Here's what he had to say.
There comes the acknowledgement that, like, oh, all these emotions, all this is overwhelming. And so I think helping the men, one of my goals would be to help the men to start talking about how they feel, putting you know, descriptive words, little kind of keywords to describe these emotions. Because sometimes I think for men, they have a hard time describing what they're feeling.
Yeah.
And, you know, just giving them a chance to just let it all out and get that opportunity to just say it, even if it doesn't, half of it doesn't make sense, or it's not, you know, eloquent or anything. It's like, hey, let's just get this out. You get it out. We'll figure out how to put it together to describe what you're feeling. So I think it's important to be able to tell men that, hey, this is the perfect time to start doing the work to work on your mental health.
Will and I both work with older adults right now. We did some reflecting on some of the themes that we see in working with our male patients. There tends to be this lack of ability to label your emotions, as well as this toughness with, I would rather have anything else be wrong with me than have mental health issues, right? And, you know, I can think of a number of times when I've been in the office and have given feedback to someone after their evaluation and said, well, great news, you don't have dementia. But I do think that there is an element of depression, and we can treat that. And they've been very upset to hear that, and just wouldn't believe that that was what was going on for them. And would have almost rather have had dementia diagnosis. And I'm sure you've probably had that same experience.
Absolutely. You know, there's such an emphasis on, you know, let it be physical. You know, if something's physically wrong with me, I can deal with that. I can push through it how do you describe pushing through mental anguish and things like that? So I definitely agree with you that there is this just lack of acknowledging that the brain is an organ just as much as any other part of the body, and if you don't take care of it, you're gonna have issues.
Yeah, and I think it's really important too, when at least when I talk to my patients, I talk about depression and other mental health issues as something that's truly happening in the brain. Like, this is not something that you caused. This is not something that you did wrong. This is not something that is defective about you. But just like other parts of your body can be injured, there are changes that are actually happening in the brain. And that's something that, you know, as much as we like to think that we can just control how we feel, we really can't sometimes. And that's when we really do need to get that help. Will told me a folk story about a man named John Henry. Long story short, John Henry was a very strong Black man who was in a race against a drilling machine to help construct a railroad. John Henry ended up winning this race, but unfortunately, he died shortly after his heart gave out from stress.
There's this mentality, particularly in the Black community, to just work yourself to death. And we need to be able to get out of that because we're not addressing those mental factors or mental issues that are going along with the physical issues that are important. So it's just something that people should think more about, like what mantras, what things have we been taught that we're still replaying out in our communities.
Men are much less likely to take a mental health day from work or a vacation or anything, and are much more likely to hide stress. But why do you think we get vacation days? Because we know that we need to replenish ourselves. All right, so now I want to move into talking about what we do, or we do much less of right now, but therapy. So why do you think that therapy is important for men?
Oh man, there are a number of reasons. Like we've kind of talked about before, men do not talk about their emotional difficulties, yet they manifest in a lot of different ways in society, externalizing behaviors. You think about young boys and adolescents, they manifest in behavioral issues in school, they manifest in juvenile issues as they get older, truancy, vandalism, things like that. And then they can also manifest into, crimes that are, more serious. So we see that there is this disproportionate amount of men who are probably not talking about the issues that they need to be talking about. Everybody could use somebody to talk to about the issues that they have going on. So it's vital that, men seek the help that they need. We know that it can improve interpersonal relationships, so it can improve marriages, it can improve relationships with children, it can improve relationships with co-workers, it can improve productivity at work. So we know that when you feel better and you feel less depressed or less anxious, you're going to feel better in life. And that's going to help to improve that life expectancy. I can't tell you how many men I've talked to where they're just stressed beyond relief, and they don't want to really change anything to do it. I got to keep working, I got to keep going, I can't stop. Yet they're working themselves into the ground. And if they just took, like you said, a mental health day, that would do wonders for them. But I think it goes into figuring out how to help them to see that that's not a sign of weakness, but a sign of reflection, humility, and strength.
When working with different groups, as psychologists, we often consider best practices. So best practices for working with people of different ages, disability, ethnicity, religion. Can you tell us about some of the best practices for working with men and maybe how that might make them feel more comfortable coming to therapy?
When we're working with men, the most important thing is to get to know the individual and figure out obviously what issues are impacting them, whether it be depression, anxiety, but how their identity impacts the expression of that anxiety or depression. So understanding that for some men, while we initially think of depression as sadness, they often show it as anger. So understanding how they express their emotions what were they taught in their home? So asking questions about, what was it like for you growing up? How did you learn how to express your emotions? What was acceptable? What were the acceptable ways to talk about issues and things like that? So getting to understand how that gender expression or their identity impacted them with their immediate family, with their peers, their friends and those around them, and with the world overall. Because we know that gender identity, so what we're talking about is that idea of like, well, how do I see myself as a man?
Mm-hmm.
What are the qualities that I use to describe myself as a man? How do they impact me in the world?
And let's just talk about, how do you recommend that men talk to their friends, their other family members about what's going on in their life?
I think about how I'm feeling and I try to describe it as best as I can. So I may say, hey, I'm struggling. I'm struggling this week.
Mm-hmm.
Well, what's going on? Tell me about the situation. And, I just try to say that, hey, it's hard for me to talk about what's going on with me. So I may need your help a little bit to kind of, I may need you to reach out, because I think one thing I see with a lot of guys, especially my friends and myself, is that we don't want to reach out.
Mm.
And, having somebody who can say, hey, I'll reach out to you.
Mm-hmm.
If you want me to reach out to you, I will reach out to you and check in on you. I think that can be valuable. And while it may not, every time you reach out, let's say you reach out once a week, something may not be going on every week, but then you might reach out and say, hey man, this week's been tough. Well, let's talk about it. Let's see what's going on. And just trying to find a way to, get each other to say, hey, I'm here to listen. I'm not going to judge you. I just want to be, you can be as open as you need to be.
Mm-hmm.
So I try to be open. I try to tell other people, hey, try to be open and not try to put your own perspective on it. Not try to say, hey, well, I would have done it this way. Well, that's you. That's not me. That's not my thought process. And that makes people want to shut down more when they feel judged or they feel like, I can't talk about this. I can't be open and honest with you.
Yeah, I think those are great recommendations. And, something that I notice is that men more so have a tendency to want to jump to this problem-solving mode of, okay, you're telling me something, I have to fix it. When that's not necessarily what your friends need all the time. Sometimes they do just need somebody to listen to them. And if they feel like you're going to tell them, oh, you should have done this, or, all right, let's just jump right into action, it's hard for you to feel heard sometimes. So really just provide that space for them to say, hey, this is how I'm feeling. If they want to go into it in more detail, they can. And if not, then just open up that space for them, though. And then maybe the next conversation they have, they'll go into it a bit more.
And we have to say that, hey, emotions are normal. It's normal to feel this way. It's normal to cry, to feel sad. There's a really good book that I've read, Cry Like a Man by Jason Wilson. And it's a really good book about a man going through experiences and how he talked to his son and his father and those around him about emotional issues that I think.
Wow, I think they made a pretty good case for checking in on your mental health. So big thank you to Dr. Will McBride for contributing his expertise to this conversation. I am so happy to see that there has been a shift in the way that men talk about their emotions. There are plenty of men in positions of influence who have used their platforms to talk about their mental health journeys, such as Kevin Love and DeMar DeRozan, Dwayne "The Rock" Johnson.
I found that with depression, one of the most important things you could realize is that you're not alone.
Michael Phelps.
Over those 3 or 4 days where I didn't want to leave my room, I didn't want to talk to anybody, I finally realized that I can ask for help and it's okay to not be okay.
And many more. This helps to normalize emotions and helps to let other people see that it's okay to not be okay all the time, to not have everything together, to talk to your family and friends about how you're feeling, and to seek professional help. And ladies, I encourage us to allow the men in our lives to express their emotions without fear of being judged. I think that is true strength. Lastly, here are some tips for men to maximize physical and emotional health. Go to regular doctor's visits, exercise, eat healthy foods, including increasing fish and chicken, eating green leafy vegetables and berries, whole grains, nuts, and decreasing sugar and red meat. Sorry. Get help to stop smoking. Avoid binge drinking. Sorry to ruin the fun again. Use your vacation and sick days. Please take a day off. Take notice of what stress looks like for you and keep some strategies in your back pocket to decrease stress in the moment. So let's say for you, stress looks like your shoulders are creeping up and getting higher. And so sometimes you may just need to take a deep breath and release. Or if you notice that you really hold stress in other parts of your body, do some tense and release and tense and release. And I promise you'll feel a lot better. If you're sleeping more or less than usual, that might be a sign that something is off, as well as if you find that you're getting more and more irritated with your wife or with the kids, that may be a sign that something is off and you need to just take a break from that moment, step back, go for a walk, decompress, and then come back to whatever that is later. Try yoga and meditation. These techniques have a positive influence on your physical health, your mental health, and focus. Talk to family and friends that you feel comfortable with. Talk to a therapist. You might try group therapy or individual therapy or online therapy. There are two main things that I want you to remember when it comes to therapy. The first is that therapy is not just for people who have severe mental illness or for people who you feel are severely depressed and they can't get out of bed. Okay, keep in mind that everybody expresses stress and emotions in different ways, and I think therapy is for everybody. It's for people navigating day-to-day stressors. It's for people going through life transitions. It's for people dealing with stress at work. It's for people dealing with relationship stress. It's for people dealing with everyday worry and so much more. The number 2 thing to remember is that the best determination of how you'll do in therapy is your fit with that therapist. So let's say you go to a new barber and that barber completely jacks up your haircut. Are you going to stop getting your hair cut? No, you're going to go find a barber who knows the right way to cut your hair. And that's the same thing that applies to therapy, okay? So you may not find the therapist that's right for you on the first try, and that's okay. But I encourage you to not give up on it and to go find someone who you actually vibe with. I hope you enjoyed this video and learned something from it. Let's commit to a healthy June. I'll see you in my next video. Bye.